Granted, there are no easy solutions on this issue, but I have significant concerns related to this bylaw. My first concern is really about the lack of public health and civil liberty considerations in this short-term strategy to address what really is long-standing poverty, addiction, and mental health issues. My second concern around this bylaw is regarding process and the speed of the proposed recommendations. I certainly suggest that we slow down and properly consider the outcomes and consequences, both long and short term, of any actions we consider taking here today or to address this problem in the long term. And in my mind, that means proper consultation and coordination with service providers in a concerted effort to offer supportive housing and detox on demand to the people camping on Pandora Green. People's lives and the health of this community are at stake here, and I think it behooves us to follow evidence-based policies and approaches that are comprehensive and holistic and don't just try and solve this problem piecemeal. There are many unknowns about what's going on in Pandora and what the consequences of these actions might be. For example, we don't know exactly what led to the people who are living on Pandora Avenue. We don't know what background they came from in many cases, and we don't know how they arrived at this grassless patch of dirt. We also don't know where people who are currently sleeping on Pandora Avenue will go if we pass this motion. We do know that they're not likely to go to our shelters because they're currently not using our shelter system. So these things remain largely unknown to most of us. There are some known facts that I think should address our considerations here. We know, and evidence suggests, that displacement in residential neighborhoods has some very real consequences and predictable consequences and negative impacts, and that includes an increase in the spread of HIV/AIDS and Hep C, and an increase in needles and petty crime in residential neighborhoods. We have reports that suggest that after we closed Cormorant Street, we didn't solve the problems at Cormorant Street. We led to much deeper and broader problems in terms of the reuse of needles and the increase of and spread of diseases like HIV/AIDS and Hep C. We know from past displacement efforts that when we try and enforce in an area like this, that people get displaced in our residential neighborhoods. These are known facts. We also know that Hep C and HIV/AIDS are bigger threats than being struck by a car or gastrointestinal disorders faced by the people living on Pandora Avenue. They have a higher chance of getting Hep C and HIV/AIDS from the lack of services than they do of getting struck by a car. And our policy choices to protect these individuals should reflect this reality. What we also know, and is quite clear in regards to the safety of these individuals, is that we haven't done what we can to protect these individuals, if that is the real concern that we're trying to address here in this bylaw. We haven't put in, for example, a mid-block crosswalk that might slow down traffic in that area. We haven't looked at traffic attenuation measures such as speed bumps or shoulders that might slow down the traffic there. And of course, the reestablishment of well-funded comprehensive harm reduction services would be something that would absolutely reduce the spread of disease in that area. So these things absolutely need to be considered. I suggest that there are other options before us and that there are better solutions. I think that we need to offer detox on demand, that we need to offer housing with supports, and that we need the province to immediately help us fund these essential emergency health services. It's interesting because the way this bylaw has been written, it actually states that it's possible to be exempted from the bylaw for a medical emergency. And if the conditions on Pandora Avenue right now don't qualify as a medical emergency, I'm not sure what will.
Gallery, we'd appreciate you respect the fact that we are in meeting here. Thank you very much.
I think we need to slow down. We need to coordinate an evidence-based strategy that's fully funded and to focus on real long-term solutions rather than knee-jerk actions that will further oppress and marginalize this population and that will lead to displacement rather than actually acknowledging, addressing, and working together to resolve this issue, which I know is the goal of everyone sitting at this table. So I won't be supporting this motion because I honestly believe that it will fail to address or better the issues faced by residents, by businesses, and by the individuals currently living on Pandora Green, and that any short-term goal will be outweighed massively by increased long-term problems for all of these stakeholders. I urge Council to consider and to support a more holistic, evidence-based solution, and I look forward to hearing from the public, from the social service providers and others on this matter when and if it comes before Council. Thank you.